Hello, my beautiful family. Hope you're all doing well today. I am Dr. Linda, and today we will be discussing about a patient that visited the hospital with serious symptoms. The warning signs were easy to ignore until his kidneys started failing. At first, it sounded like simple exhaustion from a stressful week, but when this patient mentioned swelling in his ankles and foam in his urine, I immediately became concerned that something much more serious was happening. Welcome back. If you enjoy real hospital stories, medical education, and learning how doctors recognize hidden illnesses before they become dangerous, make sure you subscribe and join us as we explore the realities of medicine one patient at a time.
It was a busy afternoon clinic when a man in his late 40s slowly walked into the examination room. He looked tired. Not the kind of tired people describe after a poor night's sleep, but the kind that sits heavily on the body. He told me he had been feeling exhausted for weeks. At first, he blamed work stress. Then he noticed his shoes feeling tighter around the ankles. A few days later, his wife pointed out that his face looked unusually puffy in the mornings. What really caught my attention was when he quietly added, "I've also noticed my urine has been looking foamy lately." That combination of symptoms immediately raised concern. Swelling in the legs or face, changes in urination, persistent fatigue, and foamy urine can sometimes point toward kidney disease, a condition many people don't recognize until it has already progressed. The patient admitted he had ignored the symptoms for a while because none of them felt dramatic on their own. That's one of the difficult things about kidney disease. In the early stages, the warning signs can seem surprisingly subtle.
As I began the examination, a few things stood out right away. His blood pressure was significantly elevated. He also had noticeable swelling around both ankles, and his skin appeared unusually dry. When I asked about urination changes, he explained that he had been waking up more often during the night to use the bathroom. He also mentioned feeling mentally foggy and struggling to focus at work. At that point, we ordered several important tests. These tests include blood work to evaluate kidney function, urine testing to check for protein leakage, and additional labs to assess fluid and waste balance. For those unfamiliar, healthy kidneys act like highly specialized filters. They remove waste, balance fluids, regulate blood pressure, and help maintain important minerals in the body.
The urine test revealed elevated protein levels, which explained the foamy appearance he had noticed. His blood tests also showed signs that his kidneys were not filtering waste as effectively as they should. Although more evaluation was still needed, the overall picture strongly suggested chronic kidney disease. Kidney disease occurs when the kidneys gradually lose their ability to function properly. There are many possible causes. Common ones include long-term high blood pressure, diabetes, certain autoimmune conditions, chronic dehydration, infections, and even some medications when used improperly over time. One reason kidney disease can become dangerous is because symptoms often appear slowly. Many people dismiss early warning signs like fatigue, swelling, dry skin, reduced appetite, or changes in urination. Unfortunately, by the time symptoms become obvious, significant kidney damage may already have occurred. The swelling happens because the kidneys struggle to remove excess fluid efficiently.
The urine test revealed elevated protein levels, which explained the foamy appearance he had noticed. His blood tests also showed signs that his kidneys were not filtering waste as effectively as they should. Although more evaluation was still needed, the overall picture strongly suggested chronic kidney disease. Kidney disease occurs when the kidneys gradually lose their ability to function properly. There are many possible causes. Common ones include long-term high blood pressure, diabetes, certain autoimmune conditions, chronic dehydration, infections, and even some medications when used improperly over time. One reason kidney disease can become dangerous is because symptoms often appear slowly. Many people dismiss early warning signs like fatigue, swelling, dry skin, reduced appetite, or unfortunately, by the time symptoms become obvious, significant kidney damage may already have occurred. The swelling happens because the kidneys struggle to remove excess fluid efficiently.
Foamy urine can occur when protein leaks into the urine, something healthy kidneys normally prevent. Fatigue develops because waste products begin accumulating in the bloodstream, affecting energy levels and overall body function. This is why early medical evaluation matters so much. For this patient, our first priority was stabilizing his condition and preventing further kidney damage. We discussed blood pressure management immediately because uncontrolled hypertension can significantly worsen kidney disease over time. His treatment plan included medications designed to help protect kidney function and reduce excess fluid buildup. We also carefully reviewed his diet, hydration habits, and medications he had been taking at home. In many kidney disease cases, patients may need to reduce excess sodium intake, monitor fluid balance, and avoid certain over-the-counter medications that can place additional stress on the kidneys. We also arranged close follow-up appointments with repeat laboratory monitoring. And this is extremely important to understand. Treatment for kidney disease is highly individualized. What works for one patient may not be appropriate for another. Anyone experiencing symptoms should always seek evaluation from a qualified healthcare professional rather than attempting self-treatment. One of the biggest misconceptions about kidney disease is that it always causes severe pain early on. In reality, many people experience little or no pain at all. That's why regular health screenings can be incredibly valuable, especially for people with high blood pressure, diabetes, a family history of kidney disease, or long-term health conditions.
Some important warning signs people should never ignore include persistent swelling in the legs, ankles, or face, foamy urine, extremity urine, persistent nausea. Simple lifestyle habits can also help support kidney health, including staying hydrated, controlling blood pressure, managing blood sugar, avoiding smoking, maintaining a balanced diet, and attending regular medical checkups.
And if symptoms suddenly worsen, especially swelling, breathing difficulty, chest discomfort, or severe weakness, urgent medical attention is important. Thankfully, this patient sought medical care before his condition became a medical emergency. Over the following weeks, his swelling gradually improved, his blood pressure became better controlled, and his energy levels slowly started returning. But perhaps the biggest change was his awareness. He told me he never realized that something as simple as fatigue and ankle swelling could signal a serious underlying condition. That conversation stayed with me because many patients make the same assumption every day. Sometimes the body whispers long before it screams.
I'm Dr. Linda, and I hope this story helped you better understand some of the early warning signs of kidney disease and why paying attention to subtle symptoms can truly matter. Make sure to subscribe and join our community. And as always, take care of your health, listen to your body, and never hesitate to seek professional medical advice when something doesn't feel right. I'll see you in the next video. Dr. Linda on call signing out.